Module 21, IDR Biology, why it works. In this module, let's understand why the phenomenon of bone graft incorporation and remodeling process happens. Now let's focus on biology of bone graft harvest from maxillary tuberosity. And let's understand why this phenomenon happens. Here we have the pre-op, 1 week, 3 months, 6 months, and 6 years. We have 5 CBCT scans. And take a look at that. 1 week after the procedure is finished and 6 months later, we have the same dimensions of the bone grafted. And the bone graft that it was placed above the implant platform remodeled above the implant platform. And in 3 months, we have the early bone remodeling process. We cannot see anymore the connection between the remaining bone and the bone grafted. And we have the bone repair process almost completely ready after 3 months. Here we have a dry skull. Let's take a piece of bone from this skull the same way that we take bone from the patient's mouth using the same tool, the chisels. We took a piece of bone and we evaluate through a microtomography. And the outer aspect of this bone, we have a thin cortical layer, but in the inner part of this sample, you can see the trabeculae. And the trabeculae is highly porous. And let's evaluate the histology of this bone. We took a little piece of bone from the tuberosity and we evaluate this sample through a photomicrography. And you can see here the cortical layer, the trabeculae, and the endosteum. And we can also see the periosteum covering this bone. Let's zoom in this histological section at the trabeculae position. And you can see here a good number of osteocytes. And let's zoom in the endosteum area. Here you can see a high number of viable cells ready to be transplanted from the donor site to the receptor site. And how about this bone after this bone is being crushed? Do you think it's possible to notice a good number of viable cells after we crush this bone to reduce the size of these particles? Let's take some piece of this particulate bone, just small particles. Let's evaluate this through a scanning electron microscopy. Zooming in this image, you can see here the reversing canal. Zooming in again, let's focus in this area. Let's zoom this area. What can you see here? A high number of cells, different cells, and a fiber net. But we are sure that we also have growth factors such as BMPs. So the tuberosity carries the 3 fundamental properties to bone repair processes. Osteoconduction, we can use this bone as a framework. Osteoinduction, release growth factors to the receptor site. And osteogenesis, a lot of cells capable of a new bone formation. If you make a comparison between biomaterial and tuberosity, biomaterial is white and dry, while tuberosity is red and wet. Biomaterial only has this property, osteoconduction, while tuberosity carries the 2 other fundamental properties to bone repair process, osteoinduction plus osteogenesis. Biomaterial cannot yet be considered as a bone substitute. It's because bone substitute means that something that can be used instead of something else. But it's not the case at this moment. Biomaterial still need autogenous graft, either using bone or soft tissue graft to improve the static outcomes. This is an article that was published in 2017 by Journal of Osseointegration. In this paper, we evaluated tuberosity clinically tomographically, histologically, and through micro-CTs. And I also recommend you to read this paper that was published in 2019 by Stoma Edu Journal, The Role of the Maxillary Tuberosity in Periodontology and Implant Dentistry. And this chapter 11 of this book, Implant Therapy, the main focus of the chapter 11 was the maxillary tuberosity as the main donor graft area. It was possible to notice in this module why maxillary tuberosity is our first choice in the IDR technique application.